CNA Exam Strategies. Welcome to the quiz. Question 1. A 74-year-old patient with a history of congestive heart failure who is taking furosemide, a diuretic medication, reports feeling lightheaded and dizzy when transitioning from sitting to standing positions. Mr. Jenkins nearly lost his balance this morning when getting out of bed, and he describes seeing black spots when he stands up quickly. Based on his symptoms and medication regimen, which specific condition should you suspect and promptly report to the nurse? Option A. Uncontrolled hypertension with elevated systemic blood pressure. Option B. Orthostatic hypotension related to medication-induced volume depletion. Option C. Hyperglycemia potentially indicating undiagnosed diabetes mellitus. Option D. Urinary tract infection causing generalized weakness and malaise. The answer is B. The symptoms describe orthostatic hypotension, postural hypotension. Question 2. Prevention of pressure injuries represents a fundamental responsibility for nursing assistants caring for patients with limited mobility. As you develop a turning schedule for Mr. Davis, a completely bedridden patient with multiple risk factors for skin breakdown, you must establish appropriate frequency for position changes. According to evidence-based practice guidelines for pressure injury prevention, how often should a completely immobile patient's position typically be changed to minimize pressure on bony prominences? Option A. Every 30 minutes to ensure constant pressure redistribution. Option B. Every 1 to 2 hours to prevent prolonged pressure on any single area. Option C. Every 3 to 4 hours to balance care needs with practical considerations. Option D. Every 6 hours coinciding with major care periods throughout the day. The answer is B. Patients should be repositioned every 1 to 2 hours to prevent pressure injuries. This frequency allows adequate time for tissue perfusion to recover while preventing prolonged pressure that causes ischemia and tissue damage. 30 minutes is excessive and disrupts sleep and comfort unnecessarily. 3 to 4 hours allows too much time for pressure damage to begin developing. 6 hours guarantees pressure injury development in most immobile patients. The 1 to 2 hour guideline balances prevention with practical care considerations and patient comfort while effectively reducing pressure injury risk. Question 3. Before assisting a postoperative patient with her first attempt at getting out of bed following abdominal surgery, several preparatory steps must be completed to ensure safety. As you approach Mrs. Chen's bedside to help her transfer to a chair, which action should you perform first in the sequence of preparatory activities for a safe patient transfer? Option A. Lock the wheelchair brakes securely to prevent movement during transfer. Option B. Raise the hospital bed to an appropriate working height to protect your back. Option C. Ask the patient to rate her current pain level on a 0 to 10 scale. Option D. Review the care plan and check for any specific activity restrictions or precautions. The answer is D. Always check the care plan first to identify any specific restrictions. Question 4. Accuracy in temperature measurement requires understanding the relative reliability of different assessment routes in various clinical situations. When discussing temperature measurement techniques during a new CNA orientation, the nurse educator asks which route typically provides the most accurate core body temperature measurement in clinical practice. Which temperature route is generally considered the most accurate reflection of core body temperature when properly obtained? Option A. Oral temperature obtained with a properly placed digital thermometer. Option B. Axillary temperature measured in a dry armpit with arm positioned correctly. Option C. Rectal temperature obtained with appropriate lubrication and insertion depth. Option D. Tympanic temperature measured with the ear canal straightened appropriately. The answer is C. Rectal temperatures are considered the gold standard for core body temperature measurement because the rectum is close to core body temperature and less affected by external factors. Oral temperatures can be affected by recent food/drink. Question 5. Proper catheter care techniques are essential for preventing healthcare-associated infections in patients with indwelling urinary catheters. As you prepare to provide routine catheter care for Mr. Wilson, who has had a Foley catheter for 3 days following prostate surgery, you gather your supplies. Which solution should typically be used for daily catheter care according to standard infection prevention protocols? Option A, antibacterial soap mixed with warm water for gentle cleansing. Option B, hydrogen peroxide solution for its bubbling antimicrobial action. Option C, isopropyl alcohol for its rapid evaporation and disinfecting properties. Option D, povidone iodine solution for broad-spectrum antimicrobial coverage. The answer is A. Mild soap and water is recommended for routine catheter care. Antibacterial soap with water effectively cleans without disrupting normal skin flora excessively. Harsh solutions like hydrogen peroxide. Question 6. Patients with documented dysphagia, difficulty swallowing, require special precautions during feeding to prevent serious complications. As you prepare to assist Mrs. Gomez, a stroke survivor with moderate dysphagia, with her pureed lunch, you recall the most significant complication associated with improper feeding techniques in this population. A patient with dysphagia who is fed improperly is at highest risk for developing which specific respiratory complication? Option A, aspiration pneumonia resulting from food or liquid entering the airway. Option B, urinary retention related to autonomic nervous system dysfunction. Option C, pressure injuries from prolonged positioning during extended feeding times. Option D, severe constipation due to inadequate fluid intake with thickened liquids. The answer is A. Aspiration pneumonia is the most serious complication of dysphagia. Great job! Don't forget to subscribe. Bye.